All right, we're live. Today I got a special guest, my bro from growing up, grew up together, me and Ivan. So Ivan, I'm like the format, the way the format of the show is gonna go always is I explain how I met, and then what they do, and then how they maybe can help you. So I met Ivan when I was like 10 years old. I don't know, 7, 8, something like that. We grew up in the same internet problems. I jumped on the wrong Wi-Fi.
Yeah,
So Ivan went to school for communications. We always worked together on different things. He actually interned at a place that I was interning at, and I actually started working for. But Ivan, tell him your story. Tell him what you do, and then let's talk about what I brought you on to talk about.
definitely, Miguel. So basically, as Miguel mentioned, him and I grew up together since childhood friends, growing up in the rough Bronx streets. Um, we always had the privilege. We always had a good family. We always had good friends around us to motivate us to make sure we never got caught up into what the streets were doing. Um, as Miguel mentioned, I was able to, I was fortunate enough to go to college. I graduated from the College of Mount St. Vincent in Riverdale, New York, in the Bronx. I studied, I got a BA in marketing and advertising um, with a corporate communications degree. Uh,
Yeah.
as I, excuse me, as I finished college, it was kind of scary because I graduated basically pre 9/11. So that was tough, right? Looking for a job before 9/11 was hard, but then once it happened, it was even tougher, right? We were competing with people out there that basically had 10-year experience compared to someone just coming straight out of college. But fortunately, I was able to get a job and work in the health industry. So currently, I'm going to say, about 18 years experience working in the health industry, specifically with health plans, um, on the sales side and on the retention side. So basically, what I currently do, I work for a company who offers health coverage for low income families and as well as working families who are not offered insurance through their jobs or are not receiving insurance through a family member, such as a parent. Um, so I run a team, a sales team that basically reaches out to the community to help them get health coverage, which is something that's very important, especially nowadays, what's going on with the COVID-19 situation.
Yeah, so Ivan put up a post the other day, and yeah, I mean, he put up a post like, look, if there's anybody who needs insurance right now, reach out. So as an entrepreneur, I know entrepreneurship is tough, and then even in a time like now, it's really tough, and a lot of people are losing their jobs. So I posted, if anyone's looking for health insurance, let me know. And already I got two of your reps. I got your rep, two people already. Yeah. So basically, me and Ivan, we started a business together in the last recession, a little bit before the last recession,
Yep.
which was it was called Light Switch Advertising. We worked together in a way where we thought we could bring in people that wanted us to work on their projects, right? And we work on it overnight. So we called it light switch because we turn on the lights in the night, right? That was our cool, smart way of of marketing, right? But the company didn't work for a reason that now looking back, I learned a lesson, and I've been reading a book that kind of would have saved that company, I feel like. So the reason it didn't work was because there was 4 partners. We were equal partners, but the work wasn't being doled out equally. So we were always fighting about fairness and what people deserved in pay and in equity, and we just didn't know. We were our first business ever. So now I'm reading this book called Slicing Pie, where Slicing Pie is based on a system that allows you to track what you do, how much money you make, how much everything, and then it breaks down how much you should be paid and how much equity you should have. And I always think about LightSwitch when I'm thinking about this system. And now Paco, who just joined us, me and Paco have really started working on using Slicing Pie with everything we do, including investments and time and everything. So Paco, meet Ivan. Ivan's one of my childhood friends. Ivan is in healthcare, and we were talking before you got on about, how, low-income families or working families need healthcare right now. And one of the reasons I brought Ivan on was to educate the public right now on what they could do to get healthcare, right? Especially entrepreneurs, right? So I was telling Ivan, I already got him 2 entrepreneurs that needed healthcare. So I guess, from your perspective as an entrepreneur, as a person that lost their job, what advice would you give them on finding healthcare right now? Ivan, that was for you.
So basically, there's definitely different avenues that you can get assistance. One, I would recommend the New York State of Health website to go. I believe it's NewYorkStateOfHealth.org. You can go onto that site and basically get any information that you would like in regards to health coverage. Because basically, ever since Obama created the whole Obamacare, right? It's basically what it did in New York was generate a marketplace website. And what that marketplace website currently is, it means that you have the luxury of going onto this website, entering your information, right? Things such as your family size, your family income, any extra benefits that you're getting. And what the marketplace website does, basically, it takes all that information in, and then it lets you know what you can qualify for. So it'll tell you, there's different products that you can qualify when it comes to health insurance, right? The main one in the city is obviously Medicaid, right? So for those, the low-income families or the families that have zero income, they usually automatically qualify for Medicaid. So in the past, what was going on with Medicaid is that any provider, any hospital that accept Medicaid would take you in, and you were able to get your services. But the problem with that is basically it caused chaos in regards to your health records, right? So if you're going to 10 different doctors that accept Medicaid, that means your health records are with 10 different providers. And if something was to happen to you in the long run, to get access to those records, it would be more difficult because they're spread out so much. So what the city decided to do was create what we call managed care plans. And that's currently one of the plans that I work for. And what managed care plans do is basically what it means, right? We help you manage your care. So what you would do is when you go onto this marketplace website with the state and fill in this information, they'll tell you what you qualify for, but then they give you an option of what health plan you would like to choose, right? So whether it be my company or any other companies, you will be able to choose that plan. And what you're getting when you choose that plan is you're basically getting access to that provider network, that hospital network, that pharmacy network. So you're getting access to this network where all your health records are going to be with one location rather than be with 10 different providers. So if there's something as far as health condition that we need to manage, we can search for those records and see your medical history, basically, and understand how you should be treated for certain things, right? And then it also gives you sense of security as knowing that, okay, not only can my family join this hospital, join this particular provider, but my kids can do it, my cousins, any friends. So that way you guys can all stay in the loop on what's going on in regards to your medical conditions, in regards to your health. So right now, especially with COVID going on, I recommend everyone to go to the New York State of Health website. Unfortunately, I can't promote my own company. That's why I haven't put it out there.
Yeah.
But I also would say that if anyone needs assistance, you can always DM me at IV167 on Instagram, and I can definitely steer you the right way. Even if you feel like my company's not a perfect fit, I can always find a company for you that can provide you the services, whether it be you have children with asthma, children with obesity. that's one big thing, Miguel and Paco, in the Bronx. That
Yep.
in the Bronx we have our children have the highest rate of diabetes, highest rate of asthma, and highest rate of obesity. So these are
Those are
all
three bad
sicknesses.
things for COVID, right?
Yeah, and right now we're having one of the highest rates of COVID going on. So it's definitely it's a serious matter, and it's something that we all need to know. And if anyone doesn't have the help that they need, you definitely need to reach out, because we can definitely help you and get the coverage that you need. God forbid you have to go into the hospital because of the situation we're in right now.
Yeah. So that's why I wanted to. I was harassing you this morning. Go ahead, Paco.
Yeah, what people don't understand is that there's 62 counties in the state of New York. Well, the 62 counties, the Bronx is the lowest in being able to receive health services. Now you say, wait a minute, that can't be. That can't be. We got Lebanon, we have New York Metropolitan, we have Jacoby, we have Lincoln, we have Lebanon, we have Einstein, Montefiore. How could that be? But it is. It means that we have a lot of institutions, but in terms of services provided, people are not going to those hospitals the way they should. So we rank the lowest in 62 counties, which sounds ridiculous in terms of receiving health services, even though we have seven major institutions, medical institutions in the Bronx. So education. So what you're doing is correct. Educating, because we've been educating about managed care companies for the last 15, 20 years. Managed care companies have been around now for, you correct me if I'm wrong, 10, 15 years or 20 years. But people are still not enrolling because they just don't know how to or whatever. The other day, I saw a clip of an EMC worker, and I don't know if he was in New York or California, and he talked about doing the 18 hours and being fearful of contaminating his family and everything else. And then he said, and at the end, let me tell you, I don't have health care.
What?
I said, whoa. And AMC worker not having health care? He said, I don't have health care because I either can't afford it or whatever it is. I said, this is ridiculous. Ridiculous.
Definitely.
So what would you tell people to do? Because I think that's a big thing. Like what Paco was saying, like if you know these things exist, but you don't know how to interact with them, what would you do? Because sometimes, like the websites right now, all these websites are down because so many people are hitting them. So, like, what do you do if the website is not working?
Yeah, definitely. What I would recommend is just researching these different managed care plans. As Paco mentioned, right now in New York City alone, there's about, it used to, when I started, there was about 20 different managed care plans. Now it's reduced dramatically to about 5 or 6, just a handful. So I would definitely look up managed care plans. You can Google it, and you'll have different offers. There's different companies like Metro Plus, Health First, Fidelis, United, all these different plans that can assist. But one thing I would say is, because what we're noticing, especially with a lot of business owners, right, a lot of entrepreneurs and their employees, they always felt like they wouldn't qualify for these managed care plans, right? The idea was always that, I have to enroll into a Cobra, right? And for those who ever had Cobra, that the expense can go $800, $900 a month. So now, fortunately, that's not the case, right? You can enroll into one of these managed care plans, and it's as simple just providing your income information. If currently you're unemployed, you can provide your unemployment information. If someone's supporting you, you can provide a letter stating that someone's supporting you. And all you would have to do then is just give, proof of your age, proof of residency. That's one thing that's also a concern, right?
How do you do that now? How do you do it now if you can't go anywhere?
Everything right now, like we always talk, Miguel, and I always watch your shows in regards to technology. Technology right now is at its highest point. Everything from making a phone call to going online to downloading an app. Each managed care plan has their own apps. They have their own contact numbers that you can reach out to. And now, because everybody's working from home, basically, we have the access now to actually assist you over the phone, right? So you can actually get a hold of a representative, and that representative will do what we call a pre-screening, right? We'll look at your family size, we'll look at your citizenship status, we'll look at your income, and then based off all that information, we can determine what you'll qualify for. Because at the end of the day, everybody's going to qualify for a particular plan. Is just based off that income, right? The more money you make, probably the more you're going to have to pay. But the less money you make, you're probably going to receive more benefits, right? Because
How
that's
does it
just how
work
the
right
system
now?
is.
Like, what about the people that lost their job right now? Right? They're not
So,
making anything.
so no, that's a great question. So right now, anyone that lost their job, unemployment is creating what's called a pandemic relief, where they're offering an additional $600 a week for anyone under unemployment. So right now, even if you're receiving unemployment, you can still qualify for insurance. If you're not receiving any unemployment and you're unemployed, automatically, if you're a U.S. citizen, you're going to qualify for Medicaid, right? Which is great because then you're going to receive all the benefits you need. But for those that are receiving income and those who might have a higher income that are currently working, you still have the option of getting insurance. You'll just have to pay a little more premium, like a monthly payment. It could be as low as $20 a month. It could be as high as $300 a month. It all depends, like, like I said, on your status and on your income. But my recommendation is to definitely go online, download apps, manage. You can look up managed care and you'll see all the companies that come up. As I mentioned, Metro Plus, Health First, Fidelis are usually the top plans. You can look those up and download it, and they'll definitely give you a contact number that you can reach out to so you can have someone help you from their home.
All right. And then, go ahead, Paco. Oh, you have questions, Paco? Oh, okay. So basically, healthcare is a big part of everybody's life. So, I'm bringing on as entrepreneurs because literally day before something, an entrepreneur that lives in Westchester but operates in New York was asking me, can he get healthcare because he's not in New York City? So how does that work?
So right now, like particularly my company, there's a few other plans that do cover the Westchester County. So if you live in Westchester County, if you live in Orange County, there are plans, managed care plans that can assist you. It's just not limited to the city of Long Island, right? There's a lot of people out there live in Long Island that qualify for these plans as well.
Oh, yeah?
So it's more broad. It's just not specific to the city. Those, if you have anybody from other states, usually other states, I know New York, we pretty much do things bigger, right? Where we have multiple choices. But I would say go online to your state website and just search health insurance or managed care plans. So usually a few other states might have one or two or more plans that can help you as well. The system is pretty much the same because the state is what's controlling it. There's only a few states where maybe the federal government is controlling, right? So I mean, you might only have one option. And that's kind of the reason why Obama created this whole Obamacare that everybody's recognizing as a marketplace. Because basically what the marketplace is like an online mall. It's a virtual mall for health insurance. You put all your information in and all these options. But another Paco brought up that was very important in regards to the counties and the Bronx is social determinants. I'm not sure if you guys heard of this, but basically a lot of these managed care plans, we're focusing on social determinants. So what are social determinants, right? They're basically challenges and experiences that our urban communities are facing, right? That leads them to having poor health, right? So usually if you're in a community where there's low income, right, you're going to have poor health. So a lot of the plans now are focusing on social determinants such as housing, access to food, employment. So we're trying to focus more on that because ultimately, where the industry used to be, right, it used to be about quantity, right? How many people can I get into my plan? But now the whole focus has changed where it's about quality, and I think that's very important to state because now, instead of a doctor just getting paid for having 300 patients coming in, that doctor now is going to be incentivized by the amount of those 300 patients that are actually healthy. So now staying healthy, I know that's been a slogan right now, stay safe, stay healthy. It's actually a benefit now to the providers. It's a benefit to the hospitals. The healthier our patients are, the more the managed care plans can incentivize these people. So it's very important that we look at that because now we want to focus on what's causing bad health. right? If it's people that there's lack of income, all right, then let's work with partners, community partners that can help get our people employed. If it's lack of food, okay, let's work with food pantries and restaurant businesses to see if we can get them assistance in regards to food.
So in China, they pay the doctors according to how healthy his or her patients are. If a patient gets sick, they stop getting paid.
Oh wow.
So during the coronavirus, all those doctors must have gone broke.
Oh my God.
Wow. Yeah.
I think that was an exception, but normally on normal times, China's criteria is you as a doctor, you get incentivized by how many healthy patients you have, not by how many sick patients you have.
So that's a good transition, because me and Ivan, we have conversations all the time about opportunities in healthcare. So after this, right, where do you see the entrepreneur opportunities within technology, or even without it, in the healthcare industry? Do you have any ideas, anything you've seen from being on the inside that maybe can spark an idea?
So that's a great question, because right now, one thing we're seeing is that technology is being used more than ever in the health industry, right? So everything from something simple as an app, right? We take apps for granted now, right? Because they're so accessible. That when we were doing light switch, right, Miguel? Make it, we wish we would have thought of that app world, right? We were working on multiple websites at that time. So now, just something as simple as an app, a lot of managed care plans, a lot of health industry, not just managed care, but big companies, right, like Empire, United, they're looking to working with applications. Oscar, if I have to refer to one, Oscar is a big company that a lot of managed care plans look to in regards to the way they handle their media, their technology. So just having things of access, right? Like in the future, you're going to be able to go onto your app and you're going to be able to see when your doctor appointment is, how your health doing. You're going to be able to check your heart rate, your temperature, all these different things through apps. Also, teledoc, right? Telehealth. That's something big right now that providers are using in the healthcare industry, especially now where they can't see people face to face. So you have a lot of doctors now video conferencing their patients and going over the symptoms and doing physicals over video. So those things are big. But then also just trying to reach the community, right? A lot of things are going on with electronic messaging, right? Text messaging, emails, that sort of stuff. Before all of that, a lot of plans were just sending out paper letters, right? So we're wasting a lot of trees. We're sending letters. We already get enough junk mail. So now we're looking into just direct marketing, where we're sending them direct text, we're sending them emails, we're sending them through social media, we're contacting them. So there's a lot of opportunity for those people who are app developers, who like working with SMS text messaging. And there's also opportunity to create more online marketing and online promotion, because previously, like I mentioned, these plans were more focused on just mailings, right? Phone calls, all these calls.
School marketing. Or
Now looking at more. All right, we need people to advertise us on this website. We need more virtual marketing. I would say. So there's tons of opportunity with that right now, especially with program developers. How to build generating reports. A lot of companies now are moving more towards Salesforce, right? That was something like literally a lot of plans were just using Excel, right? Everything was doing spreadsheets, right? So now they're leaning more towards Salesforce. So if any of you are out there that know how to build Salesforce, know how to use these programs, even in our IT department, our IT departments are growing more than ever. So there's plenty of opportunity out there in the tech world for the health industry.
That reminds me of is Paco. Like Paco, do you still use what's the apps? Noom? Are you still using Noom?
Yeah.
So Paco, tell him about Noom. I don't know if he even knows about Noom.
Well, Noom is I got to it because I was listening to NPR and I heard about this app advertising in NPR and it said losing weight and changing behavior. I said, oh, that's interesting, because I at that point I've had a belly up to last year that I had not been able to get rid of for about 10 years. And I would say, you know, I know a lot about nutrition. I know a lot of exercise. I used to have a gym. I do go to the gym. I eat well. I do have a personal training, and the belly just wouldn't go away. So I said, well, let me try it. Within 60 days, I had lost like 10, 12 pounds, and I've lost total 25 pounds since September. And I'm still on it, and because I've kind of stabilized around 163, but I'm going to go down to about 145. But I'm being kind to myself during this hard period. But Noom, what it does is it works for me because it's based on data. You know they give you an interview, and they ask you in writing to submit it based on what is it that you're trying to achieve, like lifestyle changes. Then based on that, they send you messages every day. You weigh in every day. You record your food every day, and then they send you these little writings that you read, which are very, very motivational. You know, but they're sort of a boutique individually to people based on what they want to accomplish. So they change your behavior and your attitude and your worldview about certain things, whether it's food, whether it's exercise, whether it's people, whether it's how you hang out with people. And by looking at that, then they help you lose weight as a consequence.
So that's basically AI. What they're doing is they're taking in the data of everybody, and then they're taking it and saying, okay, people like this change if we give them this. So let's test that out. And then when they see how much it works, then they do it more and more and more. So it's kind of like what you're saying, Ivan, like the opportunity of the big thing that I don't understand yet is how to connect the actual healthcare data, because there's HIPAA laws and all that. You can't just do that. So with Paco, he's doing it. He's volunteering his data to Noom, and Noom is helping him. But it can't. How does it connect to his doctor's information? Because then that would help both sides, right? But right now, I don't know if that's possible.
Yeah, that's basically where we're eventually going to be headed as we continue to work with security, right? Securing these platforms and encrypting, you know, codes to which brings the point, right? If you have any of your followers or listeners that know how to do encrypting, right, and securing these platforms, there's another opportunity there for business, right? Because that's what companies such as mine are looking for, right? How do we keep our members' information safe and secure? Because that's, you know, like you said, HIPAA laws. So we got, you know, it's a fine line when you're giving out your medical history or where you're putting that information in. But so eventually we're going to get there, right? We're going to eventually get to where our medical records are going to be in an application or in some type of platform where they're going to feed back to us as to how we should be exercising, how we should be eating, you know, different things to help us.
Ivan just gave me an idea. See, that's why we do this. Remember the presentation we got a few weeks ago by your doctor for that encryption software that they wanted us to help them? Remember that? Paco, you hear me?
Yeah.
Do you remember the meeting we had with your doctor with the encryption software that we were going to help them?
Right.
So this could be an opportunity. Like healthcare could be the opportunity.
For them.
For them.
Yeah, definitely. So, it's important, right? There's all the information you can get, but it's just important to keep it secure.
Yeah. One of the things that I'm not sure about in this picture that is happening right now to all of us in the world is that you had a candidate running for office, which now suspended his thing, Bernie Sanders. And for the last, 12 years, he's been talking about universal health care. And of course, they call him a socialist, a communist, and all those things. But right now, what's happened is exactly what Bernie talked about.
Yeah.
The health system, it was unprepared. The design was not adequate to take care of the health needs of the nation, particularly when you have like 80 million who are uninsured. This coronavirus has exposed the weaknesses of the system. And so at the end of this tunnel, whether it's this year, 18 months, 2 years, depending on what happens in November, healthcare, the way that we know it today, is going to be significantly changed. Whether it's taking Obamacare and taking Obamacare to the next level, but we're going to get closer and closer and closer to universal healthcare, number one. And number two, I believe within the next 5 years, or maybe less, this whole thing of the blockchain revolution and encryption is going to come in, where a national ledger will probably be available for every person in the United States. And it's going to be done in such a way that it is totally encrypted, totally confidential. And then you'll be able to, as an individual, control your records. Because right now, all the records that you take, whether it's your x-ray, your blood examination, all of those belong to you. But most people don't know that. Most people think
like no access to it, right?
They think that belongs to the hospital, belongs to the clinic, or belongs to the doctor. That thing does not belong to them. It's yours. And we who are a little more savvy, we go to the doctors and may I have a copy of my shit? You know. But it's just, and we're being courteous. But that stuff is ours. Is ours. In the future, and I say in 3 to 5 years, they'll have to pay me. Noom would have to pay me for the data that they're collecting from me, as opposed to I'm paying them a monthly fee for using their application. But they're paying zero to me for taking my data. And so I think that's my prediction. My prediction is that within 3 to 5 years, healthcare as we know it is not going to be the same. And I'm not sure what's going to happen to managed care companies. Do you know? Do you have a sense of what the future looks like for your industry? Because you're right. There was a point where there were 2025. The competition in the Bronx was fierce, brutal, and it was quantity. Go sign them up, and you get bonuses, and those 25 companies kind of disappeared. And as you said, consolidated to, I don't know, 4 or 5 of them now. What do you think they're going to look like in 3 years from now, 5 years from now?
So right now, with the current president there's in office, there's been a great impact on Medicaid, right? So what you had was before, you had a lot of managed care plans focusing on the Medicaid population in the sense of, enrolling them, right? Helping them out. But now, because of this budget increase, it's affecting how these plans are getting paid through Medicaid now. Because obviously the business needs to be run, right? We're here, our priority is to help keep the community insured and have health coverage. But at the same time, we have to make money to sustain the business. But now with everything that's going on with all these Medicaid budgets, what's actually saving us is what Obama created, right? The Obamacare, all the plans that were created through that. And especially there's specifically a plan called Essential Plan now that we're focusing on. And what Essential Plan basically is for adults from ages 19 to 64 who normally wouldn't qualify for Medicaid and can't afford an insurance such as Cobra, right? So now these particular people, they can qualify for this plan, obviously based off their family size and income, but they can pay as low as $20 a month. They can pay $40 a month for dental and vision, and it gives them all the coverage. You have to make your standard copay, so on and so forth. But products such as those are going to save these plans because they're profitable to the plan, right? And because, as I mentioned earlier, the health plans kind of saw what was coming, right? Obviously, we didn't see this COVID situation, but we saw where the industries were going. We saw the reduce from 25 now to a handful of plans that are left. And the reason being is because all those other plans were focusing on quantity over quality. And now that we're refocusing, like you mentioned in China, what they're doing, we have that similar model now, specifically with my company, where we're focusing on quality. So now, because of that quality, we're going to be able to sustain the services that are being given out there, right? So we're going to avoid having people just go to the doctor to go to the doctor, right? Or we're going to avoid providers scheduling 10 appointments. For instance, if you're going for back pain, right? And the doctor keeps scheduling 10 appointments once a month for you to come in. And it might help you at the time when you come in to get your therapy or whatever it is for your back pain, but it's not taking the back pain away. So now that provider has to find ways to take that pain away so they can get incentivized more, which is now
like the China situation, basically.
exactly. So that's what we're leaning to more, as where we're going into more of the quality and the care and the clinical aspect, right? We even have clinical teams that are going out there to educate the community on asthma, on obesity, on diabetes, all those diseases that affect, uh, our country, particularly here in the Bronx. So what I envision in the next 3 years is if we can focus on quality and not quantity, we will be able to sustain ourselves. Now, there could be a situation where we go into self-pay, right? Like what you're saying, like universal health care. But that's something that we need, still being looking into, because America has been doing this system for so long that if they decide to create a universal health care, there's so many things that are going to be involved with that it's going to take some time, right? It's going to take some time, and there needs to be a way to see, can the plan survive within that, right? Because if not, then it could be catastrophic for the plans, honestly, right? But then if we're looking at taking out the plans, then we're looking more at a government state level controlled system, right? Because right now, the state, especially for New York, through the New York State of Health, they're just monitoring, right? They're monitoring the system, they're monitoring the data, and they're setting guidelines. But ultimately, it's the plans that are implementing these strategies, implementing these services. So if we go into something with universal health care, we gotta look more deep into that, because then we're looking at the government then now controlling our health.
So we got a question. I don't know if you can see it on the screen, but Jimmy 4x4, he works in healthcare in Chicago, and he asked, what is your opinion on the effectiveness and safety of telehealth, considering liabilities, HIPAA, less effective patient assessment, etc.?
I can speak on the effectiveness, because my company ourselves, we use a program called Teledoc. And with Teledoc, you're basically, the effectiveness is as simple as, if you have certain symptoms, right? One, you're able to have that comfort of seeing your provider, right? So it's more effective than being on a phone. Because right now we have providers that are giving services over the phone. But if you do something such as telehealth, Teledoc, you're now seeing that provider face to face, which gives you some type of comfort. So let's start with that, right? Then you're basically getting a physical done, right? And this goes back to what we were saying, the advancement of technologies. There's certain situations where the provider can check your temperature, they can check your heart rate, they can check your blood pressure. So all the things that you would normally do at a physical, you can do through these platforms now with your provider, right? So just having that comfort of knowing, okay, my doctor's checking my symptoms, I'm talking to them, they're giving me that advice. So I think that's right now being very effective. I would say for New York, it's fairly new, but now with the COVID situation, we're all adapting to the virtual world, right? Into the AI world even more than before. So I think in that way, it's making a positive effect. As far as the security, there's definitely things that we need to look at, right? Because just look at what's going on in the news with Zoom, right? We're seeing a lot of hackers hacking Zoom conference calls, Zoom meetings. So my company, we're making sure that we're using, encrypted messages, encrypted, internet lines. So in that aspect of it, but definitely the more we go towards telehealth and teledoc and video conferencing, we have to make sure that we're securing these platforms, so to not, to not open that avenue for hackers or just people who want to get data, right? Because we're talking about socials, being talking about names, anything from income, things like that we don't want to put out there, and then health issues, which is HIPAA. So definitely, I think we need to do more on the security side. But as far as effectiveness, I think that we have something there. I think it's a good thing.
Yeah, my only statement is that, my limited knowledge of this area, I know that I read enough to see that there are doctors that are doing remote operations in Africa and in different places, where doctors are being guided by a New York specialist, whether it's a heart transplant or liver transplant or a kidney transplant. that people in the Sahara, in the desert, still tending to sheep, still have a phone, but very little access to medical help. And yet, because of the phone, they're able to get advice on conditions when they are 300-400 miles away from the nearest doctor, and they're given advice as to whether they should try to get into the closest medical facility. So technology has already, for the last 5 or 10 years, been very operational and very helpful, particularly for people in remote areas who do not have access to medical services. On the more, as you drill down, the person who asked the question, Jimmy 4x4, is correct that there's a lot of work, and you two have been a lot of work to be done, because the security is almost non-existent. I mean, I for one have absolutely given up on the whole issue at this point of trying to talk or fight for privacy, because privacy does not exist. Google tells you, Amazon tells you, Microsoft tells you, Apple tells you, you sign an agreement on their very strict privacy stuff. It's bullshit. They all spy on you. They all collect data on you. They collect data on you even when your phone is off. I have a friend who's into the business, and I told Miguel this, that we went to have a conference with him, with everybody, and after making us go through trips and hoops, when we got to his house, he says, "I'm collecting old cell phones. Old cell phones are going into the freezer." And I said, "You're going to kill my phone?" He said, "No, they won't die. It'll come out again. But the only way they can't trace me is by the phone being on the freezer." And it was the first time that I heard that. I said, but I'm turning my phone off." He said, "Doesn't matter." So so Jimmy 4x4 is correct. The whole issue of privacy is over. There's a book out there called Surveillance Capitalism. It's written by a Harvard professor who talks about the advances that China is doing in invading your privacy and your security, where they now in Wuhan, where the 11 million people were, that was the epicenter for the coronavirus. They were able to tell who was walking the streets with their cameras in China, because China has now this advanced facial technology that by the cameras looking at your face and putting a little square on it, they're able to know who you are.
And they're able to tell your temperature, so they knew if you had like a fever. Right. Yeah, this shit is crazy. And then another thing that this all makes me think about is the DNA testing. So one thing that I've seen is right now they can hack your password, hack your cell phone, right? But you can change that, right? What happens if they hack your DNA? You can't change your DNA, you know what I mean? And then if they know, like you said, oh, this person's susceptible to this or that, we're heading into some crazy times when it comes to healthcare and technology.
The good thing, if you're a man of color, or a woman of color, Latino or Black, the AI gets confused as soon as it can tell white folks, it can tell white people, then it can tell Chinese people. People of color like us, it gets confused.
You know what that is though, Paco? It's because there's not enough people like us coding in it, so they haven't tested it on us.
Right. So the Teslers, if they see a little white person crossing the street, the Tesla will stop. If it's a person of color, they run them over.
Oh my God. So. All right. So, any final kind of thoughts? I guess any questions for Paco? I guess Ivan, you never met Paco. Any questions for Paco about, because Paco has read so Blockchain Revolution. What he referenced before is about. I think we spoke about the blockchain before, right, Ivan? You know what the blockchain is, right?
No.
No. So the blockchain is like a ledger that's encrypted that keeps records, and it's uncrackable so far. It will be probably one day, but right now it's the safest way to crack information and protect it. This is what they make Bitcoin on and stuff like that. So they use it first for money. But the blockchain revolution talks about how they will use it for everything moving forward. Because, for instance, health records, if you can have your health records in a blockchain that's being encrypted, you can access it, the healthcare can access it, whoever needs to access it, you can give permission to them to access it as an individual. You can say, okay, Paco wants to access my records, I'll allow it. Versus right now, we have no way of doing that. So what the blockchain will allow is stuff like that. Who knows how it gets into to our government because it's so slow to react to technology. But what Paco is saying is true. I believe Estonia, I think, there's a country called Estonia where their complete government is on the blockchain, and I think healthcare too. But any questions for Paco? Any because Paco has much experience in everything. Anything you could ask him about these times of healthcare?
So just not really a question, just a statement. I would definitely like to follow up with both of you guys offline. Because I you know, today I'm here just representing myself. Unfortunately, I don't have permission to kind of, you know, promote the company or speak on the company's behalf. But I would definitely love to talk to you both, especially you, Paco, because I know you're involved in the community, especially in the Bronx, and I think you can definitely give us some help. You know, we can kind of talk about some initiatives that we're doing with my company, and I would definitely like to follow up with that with you to see how we can help each other out.
So another thing that you just made me think about is the Meta Bronx connection. So we work with a lot of young kids that we're putting them into the technology field, and I believe the last time we checked, 60% of them want to get into healthcare. But we are like, okay, we work in startups, right? So, but we don't have that many healthcare startups right now because healthcare is a tough startup to create because of HIPAA laws, FDA, all these different things kind of make it tough to get into that industry. You need a lot of money, and investors, you know, don't invest in minorities as much, especially when that early investment is a hefty one just to deal with the public, FDA, and all this stuff. So we should figure out how to get some of our kids into some type of partnership with organizations like yours that can help us to guide that you know, connection. Because right now on our side it's tough. We have the people who are interested. We understand technology. We just don't understand the industry enough on how to make the connection, you know?
Well, definitely, Miguel, because right now, as I mentioned earlier, right, with this whole social determinants, right, we're, you know, companies such as mine, we're looking into how we can better the community. And a lot of the managed care plans that are out there now offer internships, right? So they're offering opportunities to the youth to kind of learn the business, right? No matter where you want to go into it within that business, whether it be on the IT side, whether it be on the marketing side, whether it be on the sales side, there's different opportunities for that. So we can definitely discuss that, but unfortunately, like I said, I will have to discuss that offline. But what I would say is, you're absolutely right, right? It's difficult for somebody, an entrepreneur, to say, hey, I want to create my own healthcare plan, right? We're talking about millions, billions of dollars, right? But if we're looking at, especially what you always talk about, Mike, with technology and AI and how we can better these businesses, I think that's the way we got to look at it, right? Like, what can I develop and what can I create that can help these businesses, right? And then that way I can have my own separate entity, which is my own business, but yet I'm offering the services to these major companies. And then from that way we can grow. Because I can tell you one thing, all the marketing departments of all these plans, they're trying to find new ways to reach out to the community. It's, you know, like I said earlier, it was the old way, right? Paper, direct mailing, things like that. But now they're trying to find ways through technology on how they can reach the community, how they can promote, how they can advertise. So the opportunity there is just a matter of figuring out, okay, what specifically does this plan need and how can I develop that to offer it to them?
Ivan, who do you work for?
Oh, he can't say it. He can't say it. We'll keep it out there.
No. The rule is he cannot, out of his own mouth, say who he works for to advertise it. But if he asks a question in an interview, he's got to answer the question.
That's right.
He's got to answer the question.
Unfortunately, I can't say it
He asked
because anything mentioned in regards to the company, I can be liable for it because usually the company have spokespeople, right? Or they want to give you a script, and or they got to approve the question. Actually, they got to approve the questions being asked.
All right, so I got a way around it. Ivan works for one of the 5 final companies that exist.
I can just say this: the name has health in it. That's what I can say.
Is that one of the plus companies that exist?
It's not a plus. It's not a plus.
But DM me or DM Ivan if you need health insurance. Definitely is not a time to not have health insurance. And if you're an entrepreneur, I definitely want to start creating a little bit more of an understanding of how to get into that business. Like right now, me and Paco are working with companies like that do surgery and health. I mean, surgery through virtual reality and augmented reality. And there's all kind of companies like that are getting in, but just that FDA cost and to get through, not FDA. Is it FDA? Yeah, is it FDA? I think it is. They have to get approval through the government to operate in healthcare. And that process costs a lot of money. We were working with an IoT asthma pump just to get the FDA approval. It costs hundreds of thousands of dollars. So it makes it tough as an entry point. But yeah, I think it's definitely a need, and we got to be in that industry. As like you said, the Bronx has such an opportunity. If somebody from here can understand a way to help people here, they could be rich instantly, right? It's 1.4 million people here. Like you said, we have the most asthma, most hypertension, all these different things, but there's no access to be in that business. We got to hope somebody else figures out our problems. So that's what I want to keep creating here. You always invited, Ivan. I harass you all the time to come on the show. Paco's gonna be on whenever he can be on too. But we're gonna stay on after this ends, and we can talk to Paco a little longer. Thank you, everybody, for listening. Any final words from anybody?
Just for me, stay safe, stay healthy.
You too. We'll have a talk